we want to talk about white matter, some different type of fibers. Actually, we already have seen some commissure fiber description. We also have seen projection fiber description. I'll add one more, association fibers. See, this question is asking association fibers. They are connecting the cerebrum on the same side of the brain. They do not cross the midline. The one which crosses the midline is commissure fiber, like corpus callosum is commissure fiber. And once you say so, this is not association fiber. Association fiber, this is actually the answer because it is a part of corpus callosum. And if you say it is a part of corpus callosum, then it is actually commissure fibers. You mean to say that the others, uncinate or maybe cingulum or the longitudinal fasciculus, they keep connecting brain on the same side? Yes, but not the forceps major. This is actually commissure fiber. Let us look at some more details. We are looking at the coronal section of the brain once again, removing the front of the brain and looking at the coronal section front view. These are the three fibers that could be association fiber, commissure or projection fibers. And if you are talking about the association fibers, they keep connecting the cerebrum on the same side of the midline, do not cross the midline. That was the question. Then what about the others? Others, I have commissure fibers like corpus callosum, which is crossing the midline and connecting one right side of the brain with the left side of the brain, like that forceps major was our answer, commissure fibers. And what about the projection fiber? If you remember, we have already discussed projection fiber, internal capsule, which is connecting the higher brain center with the lower brain center and vice versa. If you remember, it was dividing the basal ganglia into two parts, laterally lentiform, medially the caudate. So that is some projection fibers. Internal capsule, you see. Now, I want to talk more about the association fibers. One of the association fibers is arcuate fasciculus, seen on the left side of the cerebrum, connecting the language areas. Which language areas is connecting? The Wernicke's sensory speech area. Wernicke's sensory speech area, it is connecting with what? With the Broca's motor speech area. With the Broca's motor speech area. So we are telling that there is some arcuate fasciculus, bundle of axons, which are connecting left-sided component of brain, which is Wernicke's sensory speech area, with the Broca's motor speech area. This is some association fiber. Yes, because it is on the same side of the brain. Do not cross the midline. And what about the corpus callosum? We want more details, so that's why we are taking a transverse section and looking at the superior view of the brain. There you will find some axons connecting right side of the brain with the left side of brain, right side of brain with left side of brain, superior view. You find there is the forceps major. What is forceps major? It is some bundle of axons connecting occipital visual cortex from the one side to the other side, right and left occipital visual cortex connected by forceps major. And the fibers will be passing in the splenium part of corpus callosum. Now you have forceps minor. What is forceps minor connecting? The frontal lobe on the right side and left side. So when you connect the frontal lobe on the right and left side, the forceps minor, the axons, where they are found in the corpus callosum, the genu part of corpus callosum. That will be genu part of corpus callosum. And how do I connect the parietal with parietal or the temporal with temporal? Temporal lobe is connected with each other by the tapetum fibers. Tapetum fibers are the axons which will be connecting one temporal lobe with the other temporal lobe. So those tapetum fibers, part of the corpus callosum, where they are passing in the corpus callosum, which part of corpus callosum it is passing. So to find out the answer, we will look at some details of the corpus callosum in a sagittal section. In fact, you already have seen corpus callosum is a C-shaped structure. Now, if you say it is a C-shaped structure, it will have a anterior side which is called as rostrum, a bend which is called as the genu, then there is a body or the trunk region, and then there is a splenium which is on the posterior side. Splenium is the axons where you are connecting occipital visual cortex with the occipital visual cortex. If you want to connect the temporal with temporal, use the trunk region. And if you are connecting frontal lobe with frontal lobe, use the genu region. So, as you see, this is the rostrum, this is the genu, that is the trunk region, that is the splenium, and we want to talk about various connections it is doing. Let us do it. See, if you are talking about corpus callosum, this is a sagittal section, and what we have learnt is, if I want to connect the frontal lobe with the frontal lobe, the fibers are called the forceps minor, and they are passing through genu of the corpus callosum. They were forceps minor. And if I am connecting the occipital visual cortex of right side with left side, their fibers were passing the splenium, and it was forceps major. Connecting right side with left side, forceps major and occipital visual cortex. But if you want to connect the temporal lobe of one side left with the right side, then the fibers will be passing in the trunk region. Those were tapetum fibers. So tapetum fibers use the trunk region to connect the temporal lobe of right side, left side. You can remember TTT. What is TTT? TTT means in the trunk region of the corpus callosum, you have tapetum fibers which are going to connect the one temporal lobe with the other temporal lobe. TTT.